there is a triple lifetime risk of lung cancer and more than 3.5 times risk of ischemic heart disease, right? The #1 killer in the United States. They are more likely to suffer from other diseases, obesity, addiction, unemployment, do poorly with school, and be involved in crime. People with high ACE scores are more likely to be violent, have more drug prescriptions, have more broken bones, have more marriages, and more work absences. This is where you see the 20-year difference in life expectancy as well, with children with an untreated high ACE score. The kicker is this: the ACE study participants are average Americans, okay? 75% of them were white, 11% Latino, 7.5% Asian, 5% were Black. They were middle class, middle-aged, educated, 40% or more had degrees, college degrees or higher. And since they were members of KP, they all had jobs and they all had healthcare, access to healthcare. So data since then on ACEs has been collected throughout the United States, which confirms the original study. This is a slide showing the states that have been collecting data since 2009. And the association between ACEs and negative health outcomes have been replicated across diverse populations around the world. Like the original study, cannot be accounted for by ethnicity, education, or socioeconomic status. These are countries like Romania, the Czech Republic, the Republic of Macedonia, Norway, the Philippines, the United Kingdom, Canada, China, and Jordan, just to name a few. This slide shows data specifically from the National Survey of Children's Health compiled in 2011 and 2012 for Baltimore and Maryland. The parts that you can see that are circled, shows the similar concerning rates to the original ACEs study. More than half of Baltimore City children have an ACE score of at least 1, and 1/3 of the children have an ACE score of 2 or more. That's over 43,000 children that are being affected right here. So some people looked at this data and said, okay, of course, if you've had a rough childhood, then of course you're going to smoke or overeat or drink or do all those things that are quote unquote bad behaviors, right? So a higher ACE score leads to bad behaviors or more health damaging behaviors, which then leads to disease outcomes. And this was the initial conception of how ACEs results in early death, but you can see there were unclear gaps at place initially. Turns out it's actually not so simple. Now scientific gaps have been filled, and the growing data and scientific research is demonstrating how exposure to early adversity negatively affects the developing brains and bodies of children. So the reason for this has to do with what's called the HPA axis, the hypothalamic pituitary adrenal axis. This is the brain and body stress response when faced with a perceived threat. It governs whether we respond by fight or flight or freeze. The amygdala in the brain is our fear center, and that is what first perceives a threat and then starts the cascade of responses. So immediately, your sympathetic nervous system gets activated, and you have neurons in your brainstem and spinal cord releasing, catecholamines like epinephrine or adrenaline and norepinephrine. And it also then starts the HPA axis, that cascade. So let me give you an example of this. I was walking with my daughter recently in an unfamiliar neighborhood, turned the corner, and all of a sudden I saw this big, angry dog running out of a person's garage, down the driveway towards us. Okay, he was growling, he was barking. I mean, I was terrified in that moment. My amygdala was like all lit up, fear, 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 right? And immediately I am feeling my heart's racing, I am looking around, I am trying to figure out what to do as this dog is coming closer and closer. My hypothalamus is sending a signal to my pituitary is sending a signal to my adrenal glands. My adrenal glands are bursting with adrenaline and cortisol and all these stress hormones that are getting me ready to decide whether I am going to fight this dog or pick up my daughter and run, right? So thankfully, the owner, came out right after the dog started running out and was able to get that dog under control. So I was able to walk away, relax, My parasympathetic system could kick in and get my system back under control. This doesn't just happen in adults. Similar reaction happened to my 1-year-old son just last month at his pediatric office. Right? Okay, so as soon as the nurse, unfamiliar to him, walked in with needles in hand, you can imagine, right? He ran to me, he didn't know what was going on, and I could feel his heart thumping, his hands got clammy, his body was tense. He was looking, staring at what she was going to do, right? He was also ready to fight or flight. And yeah, he fought when he got those shots. I mean, we had to hold him down and everything. It was awful, right? But then afterwards, he was able again to be quickly consoled, and his stress system could return to baseline. So when these kinds of scenarios activate our stress response system, it's not problematic when we do have the opportunity to return to a calm baseline. The problem is if we have stressful experiences that continue and continue and continue, that's when things can become problematic. So let's think about stress falling into 3 categories. In the first case, stress can be positive. It's actually a really good thing to have stress at some point in our lives. For example, procrastinating, those of us who need to meet a deadline, right? It can really inspire you to get that work done right away. Or if you're going to attend a sports event and you have to perform, again, it can motivate you to be a better athlete, to do better. Some people might say watching Game of Thrones, right? It's stressful, but it's positive. You get a lot of experience, you get a lot of pleasure out of it. In the second scenario, stress can be tolerable. This is when a negative experience is buffered by a strong, stable, nurturing, supportive environment. This is, for example, driving here, right? I was really stressed out coming here, talking in front of you guys. This is stressful, but you guys are providing a really supportive, calm, and great environment. So my stress level is tolerable right now. Or for example, a child who maybe gets his feelings hurt at school or is bullied at school, they can then go home, and if they have parents that they can talk to about it or process through what happened, that is another scenario where that stress was tolerable. Or my son who received his shots, right? That stress is tolerable. Final category is when stress can be toxic. This is what I was talking about. When that stress response system gets activated over and over and over again, that then puts a child in a permanent state of alert. So what ends up being adaptive and life-saving becomes maladaptive and health damaging. Toxic stress is what converts a high ACE score into a poor life outcome. The body wears out quicker if it's unable to recover and come back to a resting state. And children are especially sensitive to this repeated stress activation because their brains and bodies are just developing. We know that there is huge development in the brain in the first 2 years of life. A baby's brain grows from 25% to 80% of its adult size in that time alone, just those 2 years. Critical restructuring and neural connectivity continues then throughout childhood, which are all necessary to develop empathy, trust, and community. This slide gives an example of the dramatic growth of neuronal architecture. These are real-life images of brains of a newborn, a 1-month-year-old, a 6-month-year-old, and a 2-year-old, all the way to the right-hand side, where you can see images of neurons and their dendrites and axons all coming out and synapses forming and all that connectivity. That is really necessary and important for our brains to develop. So the problem is an overabundance of stress hormones will cause structural damage to the brains. Neuropathways can't develop the way they should or in a timely manner during those critical periods. And there's an example of how stress would shrink the brain network. The end result can look something like this. You can see how much smaller the brain of a 3-year-old child who's experienced extreme neglect is on the right-hand side compared to a normal brain. So aside from overall brain size and functioning, research has shown that there are very specific areas of the brain that are damaged, and that's what the following slides are going to show. So this slide shows the activation of the temporal lobes in a healthy brain compared to the brain on the right-hand side of someone who's experienced extreme neglect. This is a brain of a Romanian orphan institutionalized shortly after birth. As you can see, there's significant color difference between the two sides. The lack of color on the right-hand side demonstrates the lack of activity in the temporal lobes. And this is a problem because temporal lobes are absolutely necessary for language, memory, processing sensory information, and for regulating emotions. The Nucleus Accumbens, right? This is the pleasure and reward center of the brain, implicated in substance dependence and depression. In this area, the function of dopamine is changed. So what usually happens is dopamine helps you experience pleasure, okay? But in this scenario, in a trauma brain, the dopamine does not do that as well, so that you get less pleasure from activities that should be pleasurable, meaning you are looking for more and more things to do to stimulate that response to get more pleasure, to get the same effect. And you can obviously see then how this would make someone more prone to using substances, right? Toxic stress activates the hypothalamus, so part of that HPA axis. It inhibits the hippocampus and the prefrontal cortex, right? That first part of the brain necessary to make decisions, make executive function in terms of learning, memory, concentration, and impulse, self-control, being able to regulate yourself. MRI scans also show measurable differences in the amygdala. We talked about this being the fear response center. So if you think about that constantly being activated, that fear response, and you're constantly in fear, you are going to perceive a otherwise neutral event as actually being more threatening. People with high ACEs will see the world as a fundamentally hostile place. They will even perceive a neutral face, like down below, if you can see that, as being more threatening, and they will have more difficulty calming down after a confrontation. So the parts of the brain that regulate decision-making, emotional regulation, higher order thinking like judgment are all less developed, leading to cognitive delays, lower IQ, problems with language development, problems with judgment, problems with making decisions, and problems with communicating. They are likely to be perceived in school as poor learners, disengaged, maybe even mislabeled as having attention deficit disorder. This is what is known as epigenetic factors. It's the way external factors alter our gene expression, which can be then passed down from one generation to another. So, the toxic stress that affected you as a child, for example, made your genes, turned them on and made you more likely to develop heart disease, or more likely, for example, to just have low frustration tolerance and get really angry over things easily. That DNA is then passed on to your child, and then it just perpetuates itself.
So,
Yes.
what about an anxiety? Will that be also plus?
Same idea with mental health issues, yeah. If one of your genes gets turned on to increase your risk of mental health issues, depression, anxiety, even schizophrenia, that can then be passed down, yeah. Clearly, early adversity dramatically affects health across a lifetime. So, how do we interrupt this progression from early adversity to impaired functioning, disease, early death? Are we all just doomed? So now we get to the better part of my talk. Okay. All right, well, in the same way that epigenetic factors influence how bad genes are expressed in the next generation, the key is it also affects how good genes get expressed, right? And you can downregulate those bad genes. So if the idea of epigenetics is hard to understand, I think the best way of thinking about it is if any of you know a set of identical twins, right? As they age, they start to look a little bit different. They start to look even more different from each other than maybe in the very beginning. And that is due to epigenetics and how their genes are expressed. By knowing the science of how toxic stress affects our health, we can change it. That's the point, right? We can reverse this progression of toxic stress. And how? What's the title of our conference? Key is resiliency, right? This can counter toxic stress effects and potentially restore our stress response systems. History is not destiny. It is a fact that resilience can be learned and buffers the negative impacts of ACEs. Resiliency, if we think of it as the fulcrum on this scale, then you can slide the fulcrum back and forth, so it makes the scale kind of go up and down. Resiliency can tip that scale so that those hard and stressful things on the left-hand side are not as impactful and not as toxic. We know we are the products of our experiences. I've shown how neural circuits and connections are happening and are pruned, and that prolonged activation of stress hormones can reduce those neural connections in the brain and damage it. And the take-home point, however, is that we can still change our brains throughout our entire lives, and relationships can change our brains. Yes, the ability to change brains and behavior does decrease over time because you don't have that two-year window of time initially, but you never lose that capability. It just takes maybe more time and more effort. So how do we build and promote resiliency? We know that healthy relationships foster and promote resilience and healing. Resilience building will cultivate and improve the health and social emotional development in children and families. And ways to do this include strengthening supports, positive parenting, providing resources for the family, and basically the idea is to promote intrapersonal and interpersonal skills. Intrapersonal within the person, so that's cultivating ideas such as self-regulation, self-reflection, creating and nurturing a sense of yourself, confidence, self-esteem, right? And the interpersonal skills between people, promoting safe, stable, nurturing relationships. So turning towards the second part of my talk, what are we doing in the backdrop of all this knowledge? What are we doing specifically at KP to help prevent, screen, and heal the impact of ACEs and toxic stress? So at Kaiser Permanente, we like to treat the entire person, the whole person, mind, body, and spirit. It's one of our major reasons for why we do what we do. Permanente physicians are receiving regular education on ACEs, and pediatricians regionally will receive education to provide routine screening at annual well child checks and physicals. We educate parents about the impact of ACEs and toxic stress in the same way a pediatrician already talks about things like covering your electrical outlets, making sure that the child is riding in a correct car seat position, making sure that the child wears a helmet when they go on a bike ride. All of those natural preventative care measures, it's becoming part of that now. It's becoming part of that conversation. We know that a healthy caregiver is one of the most important ingredients to have a healthy child. So healthy, securely attached children are better able to self-regulate that stress response, whereas in disorganized attachment, the foundation for future relationships is impaired, and there are difficulties in interacting with others and reading social cues to understand the world. So if a pediatrician can pick up on issues of attachment very early on, then we can intervene to improve that attachment. These are the types of screening questions that we are using at KP for various visits throughout childhood and adolescence. If we can identify those at risk early on, we can take advantage of that neuroplasticity when children are still young and give them treatment during that critical stage of brain and body development. All the forms will definitely cover and ask for, have there been any major recent stressors going on in your life? And then as a child goes on to become a teenager, they more specifically ask the teenager, are you having thoughts of hurting yourself, or are you yourself feeling really overwhelmed? KP also provides additional well-being tools and training to support providers. That way, providers can deliver the best care experience by focusing on compassion, mindfulness, and finding meaning. This is a screenshot. I know it's hard to see, but it's of the Clinician Experience Project. It's a physician-led online resource. It has hundreds of 2 to 3 short-minute video clips that are really easy to watch and very quick to watch, and they were developed by physicians for physicians. Every Permanente physician has access to this resource and also receives bi-weekly tips. The project is about reminding us what we love about medicine. It's connecting with patients, collaborating with colleagues, building a community which we are proud to be a part, and having leaders that support what matters most to us and our patients. The suicide rate among physicians is higher than any other profession. So in terms of addressing mental health and suicide concerns within the workplace, this year, KP is committed to a program entitled the Working Minds Training. This is a suicide prevention program created for organizations specifically to proactively address the early warning signs of suicide in the workplace. The other major problem in being a physician is doctor burnout. That is a very, very real problem that not only affects Kaiser physicians, but it affects everyone around the nation. So KP has been committed to addressing this. They sponsor annual wellness weekends, which physicians are invited to attend. They provide lectures on topics like nutrition, exercise, sleep, ways to feel more fulfilled, feel more balanced, achieve a better work-life balance, etc. And forming a wellness group that sponsors activities that are social gatherings so people don't feel so lonely in what they do, right? That there's ways to connect with other people and to collaborate. There's a lunch group called Finding Meaning in Medicine, where people can go and talk to each other and inspire one another and remind ourselves of why we went into this field. If us providers can't improve our own resilience, I mean, how can we improve and provide the best care, right? So once a patient's toxic stress has impacted their emotional and mental health, that's when we will oftentimes see them in our behavioral health department, in my field. So what do we do in our behavioral health department? Well, at that point in time, it's not so much about screening questions, right, as it is as focusing on the healing component. So we still ask questions, however, related to ACEs, because that helps us understand their mental health trajectory, how they got to where they are, right? And then we're constantly promoting and developing resilience and, like I said, reversing that toxic stress back into the more tolerable, manageable stress. We use evidence-based therapies and medicine in treatment, and we strive to work in collaboration with patients always, because it doesn't work if we're just telling people what to do. They have to buy into it as well or be as committed, right? Lead a horse to water, but you can't make it drink. So we regularly collect data in the form of MPS, member patient satisfaction scores, and that can help us focus in on areas that members feel we need to improve upon to give them a better care experience. Now the problem with MPS scores is we don't get them for several months later. They're anonymous. We don't necessarily know how to address a situation right then and there. It's goals in mind of how we can make a better care experience. So what the Behavioral Health Department has done within the past year, in 2018, we actually instituted a more immediate way of getting feedback called FIC, Feedback Informed Care. Dr. Barry Duncan is the proponent of this, and KP hired him to come and train us in how to do this and deliver this. And what it means is that at every visit, we have patients fill out a 3-question questionnaire at the very end to try and understand if they had a good or a bad experience and what we can do if their visit was anything less than excellent. So, what are the 3 questions that we ask? We ask, 1, did you feel that you were able to talk about what was important to you today? 2, did you feel respected and understood by your clinician? And 3, do you understand and agree with your treatment plan? And if any of those responses are no, right, it offers an immediate availability to be able to discuss what the issues are so that the following experience can be a good one. Or you can try and rectify what happened there to get them to understand, why you came up with this treatment plan and why you want to work collaboratively with someone. So it's a really effective tool. Last year, we also instituted a training called the Zero Suicide Project with the goal of having, what the name implies, 0 suicides in the region. This involves training clinicians to learn the interventions for moderate and high-risk members. Every patient seen in our office completes a questionnaire called the BHOQ, which is a Behavioral Health Outcomes Questionnaire, and one of the 13 questions specifically asks, are you having thoughts of harming yourself or being better off dead in the past 2 weeks? If that answer is positive, the clinician then asks the member another series of questions to identify their risk for self-harm, whether it's mild, moderate, or severe. And based on this, it will determine the appropriate intervention. This includes having a more thorough safety evaluation, discussing a safety plan, and having planned follow-up or outreach to keep patients from falling in between the cracks, because that's really easy. If someone doesn't come back and see us, we don't have any idea, right? But if they hit this measure, they come out on a list and we know exactly when they're supposed to see us, and if they don't, they cancel or they no-show, we will be outreaching to them and making sure that they're okay. We have chemical dependency specific treatment options and IOP, meaning intensive outpatient programs, and other groups to support our patients. So the most effective interventions to help regulate the stress response, to help reduce those stress hormones, reduce inflammation, and induce neuroplasticity, those brain changes that are positive, include the following categories, and we've touched upon a bunch of these already. Sleep, exercise, nutrition, mindfulness, mental health, and healthy relationships. So naturally, these are the areas KP focuses on. KP offers wellness coaching, someone who will talk to you on the phone regularly to create a customized plan to meet your goals, whether that's increasing your activity, eating healthier, reducing your stress, quit smoking, all of those kinds of things. KP has a nutritionist who can discuss how to get the most benefit from your diet. Free classes are offered on improving sleep, and there are so many podcasts that one can access on nutrition, reducing stress, anger, forgiveness, again, sleep and weight loss. And there are opportunities for other group classes which help promote healthy relationships like couples counseling and to improve your mental health. So they have depression and anxiety groups, there's an adolescent skills building group, and then I've already touched upon the feedback informed care and our zero suicide project. KP is also extending beyond its members into the community to help promote resiliency in schools. Given that we know statistically 1 in 5 of our members are in a school every day, whether in the role of a student or someone who works in the school, like a teacher, cafeteria worker, a janitor, a school bus driver, you can see why having a school focus is so important to us. And if you think about students and how much of their time is spent in schools, you can also understand why this is a major area of focus, right? We want to focus on the home environment, we also want to focus on the school environment. We know that building resilience in schools is not a new idea, and many of you are likely to already be working on this important initiative. If you are interested in working with or partnering with Kaiser in some way around this work, we are happy to connect. So RISE, the Resilience in School Environments, is part of how we support the health and well-being of students, staff, and teachers. We have been on a multi-year journey to provide tools and resources to school teachers and staff to equip them to better manage vicarious trauma to mitigate ACEs and toxic stress through building resilience. KP is ramping up attention and focus to help create a national community focused on eliminating ACEs as an obstacle to success in school and life. Our goal is to touch 25,000 schools by the year 2025. That will be having many interventions and partnerships both on the ground and also virtually available to help support school resiliency. So, what will be different as a result of RISE? Imagine, if you will, a RISE school. It's a place where it supports and builds resiliency. So it's an environment of understanding and compassion. One where a student can actually learn and a teacher can actually teach. One where teachers and staff welcome students, where they are enthused to come to school. I can tell you, my experience as a teacher, I did not have that. Anytime there was an unexpected school cancellation or a snow delay, I was ecstatic. I mean, way more so than I ever was as a student, right? That's problematic. So I would love to be in a RISE school, right, where you are excited and looking forward to going to school, and if school is canceled, you're bummed out, you know? All right, it's also a place where a teacher can take a lunch break and a relaxing atmosphere. It's where a student who's acting out, instead of getting punished, they would have some other method in place, right? They could go to a calming corner, they could go talk to someone, develop coping skills or work on their coping skills. So it's again about supporting the child and helping them get through their stress response. Teachers also, right, their stress response systems get activated. So in a RISE school, if someone feels like they're starting to get out of control, or they're starting to yell at their students or really kind of lose it, right, they would have the capability of calling in another staff member to come and either relieve their class or help them so that they can go calm down, also develop their coping skills and reduce sort of that whole stress response cycle. So as I mentioned before, I imagine many of you are already working on school resiliency. If you have questions about RISE and the efforts in Baltimore, or you would like to collaborate, feel free to speak to, and I'm going to ask these people to either raise your hand as I say your name or stand up. Rachel, Brandon, Amy, or Laura. They should be here in this room from my Kaiser team. And people can connect with them after this talk if they'd like to. So these are examples of what parents and KP staff have said about learning about ACEs and resilience. The first quote is from a member who's also a teacher and a parent. She said, "Now that I'm more aware of ACEs and toxic stress, I'm working hard to provide a more nurturing and supportive environment at school and at home with my kids." The second quote is from one of the therapists actually in our department. And he said, "We now practice 5 minutes of mindfulness together before every staff meeting, and since I can feel the benefits myself, it's easy to teach others and incorporate in my own daily life." And the last quote was from a parent member, and this person said, "Since I learned that my own childhood trauma can negatively affect my kids, I'm working on myself to be a better parent and improve my own self-regulation to be able to teach that to my kids in the future. This is why I started going to therapy." What makes Kaiser Permanente even more unique, however, is the integrated care system we provide for our patients. So for this very last part of the talk, I wanted to tell you about a patient that we treated, which I think provides a really, really good example of how our integrated care model works so well. I've changed the name and eliminated other details to protect this patient's identity. And I am going to read from this a little bit more just so I get the details perfectly right. So Sarah has been a lifelong patient of Kaiser from when she was born. Her parents were briefly married, not even a year, and separated before she was 1 year old. And prior to that separation, Sarah was exposed to mostly verbal, but some physical domestic violence between the parents, dad towards mom, which resulted in mom ending the relationship. So even before the age of 1, Sarah's ACE score is a 2. During the divorce, mom fought for sole custody. The parents were awarded joint physical custody, and mom was given sole medical custody. And I only highlight that because of the fact that the patient having, the mom having sole medical custody of the patient allowed for the patient to continue to receive treatment at KP seamlessly without dad interfering or getting involved or pulling her out or forcing her to go somewhere else. So it was relevant. When Sarah was 3, mom brought her to the pediatrician with concerns that Sarah was exhibiting a lot of separation anxiety with being dropped off at dad's. The pediatrician referred Sarah to behavioral health, and she was seen within 4 days of that initial pediatric visit. At the time, there wasn't enough concerning evidence for any specific or reportable abuse. But over the course of the next 2 years, Sarah was frequently seen in KP's urgent care for concerns for burning with urination, discomfort in her pubic area, and for vaginal discharge. Of note, CPS was notified of suspected abuse during that time. It wasn't, however, until Sarah was 5 years old when she was able to verbalize for the first time that her father had touched her in her private area, and mom was able to immediately call KP's call center. The call center made a CPS report, scheduled a same-day appointment with the pediatrician for a physical exam, and contacted the therapist. This is the same therapist who had seen her 3 years prior, or 2 years prior. It was someone Sarah remembered and with whom she felt comfortable. Still that same day, the therapist outreached Sarah's mom and scheduled an appointment to see Sarah individually the very next day. Therapist was able to communicate directly with the pediatrician, so everyone was aware of the plan. And since the therapist was already looped in, knew exactly what was going on and why Sarah was coming in, she did not have to waste any time during that session gathering medical or social history. She was immediately able to start treatment, and she was able to see Sarah individually to hear the details of what happened. This was actually really important without mom being present, because it was a crucial component of the ensuing investigations, and it added to the therapist's credibility from a legal perspective. So ultimately, she had a much better outcome. No one could say that mom was swaying, what Sarah was saying in the room and that kind of thing. Sarah continued treatment with the therapist as she went on to develop acute anxiety symptoms and PTSD symptoms because investigations were going on, and she was still being forced to have visits with her father, despite mom working desperately to stop the visits. It was clear that the dad was still being physically inappropriate with Sarah during these visits, as well as emotionally manipulative. Sarah's ACE score is now 4. Sarah's stress response system was constantly being activated with the ongoing trauma. As that toxic stress developed into PTSD symptoms that were getting increasingly severe, such that she was unable to get any sleep due to persistent nightmares and was having a lot of anxieties about going to school, her therapist could walk Sarah over to my office and introduce us gradually over time so that she could grow and feel more comfortable coming to see me for medication eventually to help her sleep. Due to our coordinated care model and sharing of records, a lot of things were able to take place to provide quality and seamless care. First, I was able to see how Sarah was doing in therapy. The therapist and I were in constant collaboration. We're right across the hallway from each other, right? Sarah's mom and I could send each other secure messages through KP's secure message system without a formal in-person visit being necessary, and I could make recommendations without them having to come in. Her therapist could go up and see Sarah while she was in another doctor's office. And Sarah said just knowing that the therapist was in the same building was helpful for when she did have to come see other doctors.